Nicole Garrett, hyperbaric technician and director at Under Pressure Hyperbarics.
Hi, I'm Dr. Sam, board certified plastic and reconstructive surgeon. Today we're going to talk about stem cell therapy, fat grafting, and the benefits when combined with hyperbaric oxygen therapy. So stem cells are commonly used nowadays, as you hear it all over the literature and in media, anywhere from the head all the way down to our toes for multiple different variety of topics. So anywhere from rejuvenation in the face or other parts of our body to joint pain, knee and ankle pain, anything you can really imagine, as well as for hair transplantation, hair stimulation of growth, and things like that. So typically once we get the stem cells, we were injected into the area that is desired or infuse it based on what our treatment protocol that we're going for is. But then we routinely will combine with hyperbaric oxygen therapy to stimulate their growth and improve the uptake of those cells. We similarly do the same thing when we do fat grafting, most commonly for breast reconstruction. We'll take fat, inject it into the area needed, and then we'll combine it immediately with hyperbaric oxygen therapy the same day. And we've seen significant improvement in the amount of fat that's uptaken, decreasing the number of procedures that are required to achieve reconstruction and what that patient's goal really is.
Yeah, and you really only need a few treatments. It's not like a long treatment protocol to help increase the efficacy of the uptake.
So if you're interested or know someone who is, reach out and contact us. We're here to help.